If you have glaucoma, losing more of your vision is not inevitable. Yes, the damage glaucoma has already caused usually can't be reversed, but that doesn't mean there's nothing you can do. With the right treatment and regular follow-up, glaucoma can often be slowed down significantly, and you may be able to protect the vision you still have for many years. But there's one big problem. You usually can't feel glaucoma getting worse. Your eyes may not hurt. You may wake up tomorrow and notice absolutely no difference in your vision. You may even feel like everything is completely normal. And yet, glaucoma may still be progressing. So if you have glaucoma, what can you actually do to protect your vision? That's exactly what we're going to talk about. And first, there's something very important you need to understand. The main goal of glaucoma treatment is usually not to bring back the vision you've already lost. The goal is to protect the vision you still have. Think of the optic nerve as a connection between your eye and your brain. It contains more than 1,000,000 nerve fibers that help carry visual information from your eye to your brain. With glaucoma, those nerve fibers can gradually become damaged, and once significant optic nerve damage has happened, we currently don't have a routine treatment that can simply rebuild those lost nerve fibers and restore the vision. That's why time matters so much with glaucoma. The earlier we identify the problem and control the risk factors we can control, the better chance we have of protecting your remaining vision. But this is where people sometimes make a very understandable mistake. Someone gets diagnosed with glaucoma. Their doctor gives them eye drops. They start using them. A few months go by, their eyes feel completely normal, their vision seems fine, so they start thinking, do I really need these drops every day? And that's exactly where glaucoma can become dangerous, because you usually don't feel glaucoma treatment working. Think about a painkiller. You take it because something hurts, the pain gets better, and you know the medication did something. Glaucoma drops are different. You put the drop in your eye, and your vision probably doesn't suddenly become sharper. You may not feel anything different at all, but the medication may be lowering the pressure inside your eye and reducing the risk of further damage to your optic nerve. So one of the most dangerous assumptions you can make is, my eyes feel fine, so I probably don't need the medication. With glaucoma, feeling fine does not necessarily mean everything is fine. Now let's talk about eye pressure, because when most people hear the word glaucoma, they immediately think high eye pressure. And yes, eye pressure is extremely important. Your eye constantly produces a clear fluid, and that fluid also needs to drain out of the eye. This system helps maintain pressure inside the eye. If the pressure is too high for your optic nerve, it can increase the risk of further damage. That's why lowering intraocular pressure, or IOP, is such an important part of glaucoma treatment. But here's something many people don't know. There isn't one perfect eye pressure number for everyone. Two people could have exactly the same eye pressure. One person may remain stable at that pressure. The other person may continue to develop optic nerve damage. That's why doctors often talk about something called a target eye pressure. The question isn't simply, is my eye pressure in the normal range? A better question is this pressure low enough for my optic nerve, that difference is really important because yes, you can even have glaucoma when your eye pressure is within what we traditionally consider a normal range. This is called normal tension glaucoma. So saying my pressure is below 20, so I'm safe, is not always correct. Your doctor may consider your eye pressure together with the appearance of your optic nerve, your corneal thickness, OCT scans, visual field tests, your age, your risk factors, and most importantly, whether the disease is changing over time. Now let's talk about one of the most important things you can do to reduce the risk of glaucoma getting worse. Use your treatment consistently. That sounds simple, but in real life, it isn't always easy. Some people forget their morning drop, some use their medication for a few days and then stop, some only use it when their eye feels strange. And some people suddenly become very good at using their drops for a few days before their eye appointment. But glaucoma medication doesn't work that way. If your doctor has prescribed a medication to be used every day, it needs to be used as directed, because if your eye pressure isn't adequately controlled, optic nerve damage may continue without you noticing anything. Here's something simple that can help. Make your glaucoma drops part of a routine you already have. Think about brushing your teeth. You don't want to wake up every morning and ask yourself, should I brush my teeth today? It's simply part of your routine. Try to do something similar with your eye drops. Set a reminder on your phone. Connect the medication with another daily habit. Keep a schedule if you use several different drops, and keep the bottle somewhere you'll remember it. As long as you're following the storage instructions for that medication. Small changes like these can make it much easier to stay consistent. Now there's another issue. Using the drops correctly, you hold the bottle over your eye, you squeeze, and half of the drop ends up running down your cheek. Then you're standing there thinking, did any of that actually go into my eye? This happens all the time. For most eye medications, one properly placed drop is enough. After putting the drop in, you can gently close your eye. In some situations, your doctor may also recommend gently pressing the inner corner of the eye close to the nose for a short time. This can help reduce drainage of the medication into the tear duct and may reduce systemic absorption. If you use more than one type of eye drop, you'll usually want to leave a few minutes between different medications rather than putting one in immediately after another. Otherwise, this second drop may wash some of the first one out. But always follow the specific instructions given for your medications. Now, what if your glaucoma drops burn? What if they make your eyes red? What if you're experiencing another side effect? Don't quietly stop the medication on your own. Tell your eye doctor there isn't only one glaucoma medication. There are several different classes of eye drops, and there may be other treatment options depending on your situation. Sometimes the medication can be changed, sometimes the treatment schedule can be adjusted, sometimes another approach may make more sense, but simply stopping treatment without telling anyone can put your vision at risk. Okay, let's say you use your drops perfectly, your eye pressure looks good. Does that mean you don't need regular eye exams anymore? No, and the reason is extremely important. We can't always tell whether glaucoma is stable just by looking at one eye pressure measurement. Eye pressure can change throughout the day, so getting a good number during one appointment doesn't automatically prove that the disease isn't progressing. That's why glaucoma follow-up is about more than pressure. We also need to look at the optic nerve, and this is where OCT becomes incredibly useful. You can think of OCT as a detailed scan of structures inside the eye. In glaucoma, it can help us evaluate the nerve fiber layer around the optic nerve and other important structures. But one of the most useful things about OCT isn't just the scan you take today, it's the comparison. What did your optic nerve look like 6 months ago? What about a year ago? 2 years ago? Is the nerve fiber layer staying stable, or are we seeing a meaningful change over time? That change over time can be extremely important. This is why your previous OCT scans have value. A single scan gives us information. A series of good quality scans over time can help us understand the direction the disease is going. Another very important test is the visual field test. Now, I know it's not exactly everyone's favorite test. You sit in front of a machine, you stare at a central point, tiny lights appear in different areas, and every time you see one, you press a button. It can feel repetitive. Sometimes you start wondering whether you really saw the light or just imagined it. But this test gives us very useful information. It helps show how glaucoma may be affecting your functional field of vision. OCT gives us structural information about the eye and optic nerve. The visual field gives us functional information about what you can actually see. And when doctors look at these results together, especially over time, they can get a much better idea of whether your glaucoma is stable or progressing. Now, let's say eye drops aren't enough. Does that mean you're out of options? No. For certain types of glaucoma and certain patients, laser treatment may be an option. One example is selective laser trabeculoplasty, or SLT. SLT can be used in open-angle glaucoma to improve drainage of fluid from the eye and lower eye pressure. For some patients, it may even be considered as an initial treatment. For others, it may be used together with eye drops. But SLT doesn't work exactly the same way for everyone. The amount of pressure reduction can vary, and its effect can decrease over time. So again, glaucoma treatment needs to be individualized. Now, what happens if medication and laser treatment still don't lower the pressure enough? That's when surgery may become part of the conversation. And once again, the basic goal is the same: lower the eye pressure to a level that gives the optic nerve a better chance of staying stable. There are traditional glaucoma surgeries, such as trabeculectomy. There are drainage implants, sometimes called glaucoma tubes, and there are also procedures often grouped under the term MIGS, minimally invasive glaucoma surgery. But there is no single best glaucoma surgery for every patient. The type of glaucoma matters. How advanced the disease is matters. Your target pressure matters. Previous eye surgeries matter, and the overall condition of the eye matters. Someone with early glaucoma who needs a modest reduction in pressure may need a very different approach from someone with advanced glaucoma whose pressure needs to be much lower. Now let's talk about something that gets a lot of attention online. Can lifestyle changes stop glaucoma? You'll find plenty of claims. Eat this food and lower your eye pressure. Take this vitamin and cure glaucoma. Do this exercise and repair your optic nerve. Be careful. Eating a balanced diet, exercising regularly, avoiding smoking, and taking care of your general health are all good things, but they are not replacements for proven glaucoma treatment. A vitamin, a special food, or a natural remedy cannot currently rebuild optic nerve tissue that has already been lost from glaucoma. And if someone is selling you something that promises this will completely cure your glaucoma or you'll never need glaucoma drops again, you should be very skeptical. Now, what about coffee? People ask this all the time. If I have glaucoma, can I drink coffee? Caffeine can cause a temporary increase in eye pressure in some people, but that doesn't automatically mean every person with glaucoma needs to completely stop drinking coffee. If you consume very large amounts of caffeine, especially if your glaucoma is difficult to control, it may be worth discussing your intake with your eye doctor. What about exercise? Regular moderate physical activity has many benefits for overall health, and some forms of exercise may also have a beneficial effect on eye pressure. But certain activities are different. For example, positions where your head stays significantly below your heart for extended periods may temporarily raise eye pressure in some people. So, if you have advanced glaucoma or you regularly do activities involving inverted positions, talk to your eye doctor about what's appropriate for you. Now we're getting to one of the most important questions in this entire video. Let's say you're doing everything right. You're using your drops. You're going to your appointments. Your pressure has come down. Does that guarantee your glaucoma will never get worse? Unfortunately, no. Some people remain stable for many years with treatment, but no treatment can promise that glaucoma will never progress. And that's exactly why follow-up continues. We need to know whether the treatment is actually enough for your eyes. If your OCT or visual field shows meaningful progression, your doctor may decide that your target pressure needs to be lower. Another medication may be added, laser treatment may be considered, or surgery may become appropriate. So, glaucoma treatment isn't always one decision that you make once and then forget about. It's a process. The treatment may need to change as your eyes change. So now let's go back to the question we started with. Can you stop glaucoma from getting worse? Here's the most accurate way to think about it. We usually cannot reverse vision that has already been lost from glaucoma, but by lowering eye pressure to an appropriate level, using treatment consistently, and monitoring the disease with tools like OCT and visual field testing, we can significantly reduce the risk of further damage and often slow the progression of the disease. And many people with glaucoma can maintain useful vision for many years with appropriate treatment and follow-up. So if you've been diagnosed with glaucoma, one of the worst things you can do is panic and then do nothing. And another dangerous mistake is thinking, I can see fine, so everything must be okay. With glaucoma, how you feel today isn't the whole story. What matters is what's happening to your optic nerve over time. Use your medication as prescribed. If you're having side effects, tell your doctor. Don't skip your follow-up appointments. Do your OCT and visual field tests when they're recommended, and don't stop your treatment just because your eye pressure looked good at one appointment. Because glaucoma's ability to stay quiet is not an advantage for us. It's actually one of the biggest challenges. You may not feel the disease progressing, but we have an advantage too. we can monitor it, we can lower eye pressure, we can compare scans, we can test your visual field, and if the disease is progressing, we can change the treatment. So living with glaucoma shouldn't mean waking up every morning and asking yourself, am I losing more vision today? The goal is to have a treatment and monitoring plan that gives you the best possible chance of protecting the vision you still have, because when it comes to glaucoma, the vision you still have is incredibly valuable, and there are real proven things you can do to help protect it. If you use glaucoma eye drops, let me know in the comments what's the hardest part for you: remembering to use them every day, dealing with side effects, or simply getting the drop into your eye correctly. I may make a separate video showing the easiest way to use glaucoma drops correctly and the common mistakes to avoid. Thanks for watching, and I'll see you in the next video.